See, vaginal discharge is a normal physiological discharge that happens in every woman. It's discharge that is secreted by the vaginal glands and the cervical glands. The glands produce some secretions, and these secretions are meant to remove the dead cells and the bacteria from the vagina. So it's in a way cleansing process of the vagina that happens. So in a way it's good, and it also keeps the vagina lubricated and moist so that it helps in intercourse also. So normal vaginal discharge is a normal physiological phenomenon that happens in every woman. Normal vaginal discharge is either clear, transparent, or it may be white. If it has any other color like yellowish or greenish or reddish, then it's not considered normal. Normal discharge should be clear or transparent or whitish in color. Clear, transparent, sticky, or watery discharge is normal. Any colored, as I said before, like yellowish, greenish, is not normal. Sticky discharge is normal, but frothy or curdy white or cheesy discharge, which is an indicator of yeast infection, or any frothy discharge that is indicator of trichomonal infections, these are not common. Or any reddish or pinkish discharge, which means that it's mixed with blood. So that indicates abnormal bleeding, like from the cervix or from the uterus or from any local growth or from vaginitis. So these are the signs of abnormal vaginal discharge, and it needs to be like the woman needs to see her doctor for this. Normally, even during your normal cycles, the thickness and the consistency of the vaginal discharge changes with the hormones, under the effect of the hormones. So normally the normal discharge increases just before periods or just after periods or during ovulation. It becomes sticky and all. So this is a normal part. But when it's like more in amount, like excessive discharge, which may indicate erosion, or it's colored, or if it's itchy, if the discharge is leading to itching, or there is any irritation or burning. So these are the symptoms which indicates that it's not normal, there is something wrong. And then in that case, the woman should see her doctor and get it examined. So it indicates some sorts of infections or abnormal bleeding in the woman. Abnormal system, just I said now, the symptoms could be burning, any irritation, itching. Itching is the most common finding that woman complains of with the abnormal discharge. Or there can be irritation while passing urine or burning while passing urine. Abnormal foul odor or smell, which is not healthy. Some amount of discharge is produced all the time. So it's normal to have discharge every day. And as long as it's like a woman has everyday discharge, and if it's not, or if it has no odor, if it has no color, if it's not itchy, non-itchy, then it's perfect. It's normal to have that discharge. Taking care of your hygiene becomes important, vaginal hygiene. So wearing clean clothes, clean undergarments, cotton underwears, and if it's wet, then change your underwears. Vaginal douching is something which we don't recommend. Just clean your vagina with normal soap and water daily. That's sufficient. Cleaning your vagina from back to front is not recommended. It should always be from front to back. And using deodorant, sprays, or scented perfumes and all is not recommended. It causes vaginal irritation. Having protected intercourse, like using contraception, barrier contraception, like using condoms and all, that prevents from sexually transmitted infections. And if you have any symptoms, please see your doctor so that it can be treated. That doesn't lead to spread of the infection upwards to the uterus and all. So this is the normal hygiene that one can maintain.